Hey guys, it's Kendra with Cross Country Healthcare, and we're gonna get a little bit personal. The month of May is Nurses Month, and it's also Mental Health Awareness Month. So today we're gonna touch a little bit on mental health in the healthcare industry, and also talk about ways that you can help someone who may be struggling with mental health. I do want to give out a trigger warning that mental health will be talked about in depth today. So if this isn't a topic that you're comfortable hearing about, please feel free to click off this video at any time. If you or someone you know is struggling with mental health problems and needs support, help is available. The number for the National Suicide and Crisis Hotline is 988, which you can call or text 24/7. As of 2022, 22% of the healthcare industry reported that they experienced some form of depression, anxiety, or PTSD. And out of those who work as physicians, 69% reported feelings of depression and 13% had experienced thoughts of suicide. So let's take a moment to break down the three most common mental health disorders within healthcare, what the common experiences are of each one, and talk about the ways to potentially help someone who may be struggling. Number one is depression. The official definition of depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. The most common symptoms of depression are feeling deeply sad, having a loss in interest in things that normally bring you joy, having difficulty falling asleep or sleeping too much, experiencing an increase in purposeless physical activities such as pacing, foot tapping, hand wringing, feeling worthless or guilty, having difficulty thinking, concentrating, or making decisions, and often thoughts of suicide. When it comes to ways to potentially help or support someone who may be struggling, it's very important to understand that often those who struggle with depression or any mental health disorder often don't realize that they may have it or are aware that they do, but may not be willing to accept any guidance or help. However, we do have a handful of steps that may help someone who may be struggling. Talk to them. Explain the symptoms that you've noticed and why it concerns you. Ensure that your words and tone of voice are coming from a loving and empathetic place in your heart, because the blame game never works. You can also always offer to set up any appointments for them and pick up their medications and go with them to any appointments they may need. While these tactics may not always be successful, it's important to always do anything you can for those around you, because you never know what words or support may be just what that person needs to reach a happier state in life. The second most common mental health disorder is anxiety. The official definition of anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. People with anxiety disorders often experience intrusive thoughts or concerns that are out of their control. They may avoid certain situations out of worry. They may also show physical symptoms such as sweating, trembling, dizziness, or a rapid heartbeat. Anxiety is not the same as fear, but they're often used interchangeably. Anxiety is a response that can look towards the past, present, or future and can last for a very long time. It has a wide focus on a potential threat that is not clearly defined. Fear, on the other hand, is an appropriate response in the current moment that is short-lived and is specific to a clear and identifiable threat. When it comes to ways to help or support someone who may be struggling with anxiety, there are a few things that you can try to help. Buy them small, put-together projects or puzzles. Anxiety is very different than any other mental health disorder in that any major outside distractions during moments of anxiety can dramatically increase their levels. You can also try encouraging them to take long and deep breaths in and out. While doing this, ask them to look you in your eyes. Similarly to having them focus on a toy or puzzle, having them put all of their stress and anxiety into one centralized place, such as looking you in your eyes, definitely has a chance at helping relieve all of that anxiety. And lastly, sometimes someone struggling with anxiety just needs some space. Oftentimes, someone who is struggling with those types of feelings will get very flustered if you try to talk with them through it. It can make it much worse. So let them have their space to fill out their stress or worry, and just try to keep a close eye nearby in case they do need you. The third most common mental health disorder is PTSD, or post-traumatic stress disorder. The official definition of PTSD is an anxiety disorder that develops in reaction to physical injury or severe mental or emotional distress, such as military combat, violent assault, natural disaster, or other serious traumatic events or series of events. People who struggle with PTSD have intense, disturbing thoughts and feelings related to their experience that last a long time after the traumatic event has ended. They may relive the traumatic event through nightmares or flashbacks. They may feel sadness, fear, or anger, and they also may feel estranged or detached from other people around them. People with PTSD often distance themselves from situations, places, or people that remind them of that traumatic event. And they may have strong negative reactions to things such as loud noises or accidental touches. When it comes to ways to help or support someone who may be struggling with PTSD, there are some things you can try to do to help. Be consistent and predictable. Remember that repetition and schedules with them is key to developing a secure attachment to you. Next, you want to know what their boundaries are. While you may never know what specific event caused them to have PTSD, you may pick up on actions, words, or places that trigger them. Take some time to pay attention to those small details and be sure to avoid them at all costs. And remember, friends, never take any adverse or negative reactions to the support you try to give someone who may be struggling with mental health disorders personally. And also, never push anyone farther than they want to go. Listen to them. They will come at their own pace. And remember, positive reinforcement. Seeing anyone you know go through struggles with mental health is never fun, but if we educate ourselves on the common symptoms of each and remember to always stand in support of those around us, we can make great progress in the mental health disorder community.